You're listening to The Dr. Shoup Show.
The doctor's ready to see you now.
Let's get back to improving your life with exclusive information and consultation. Here's Dr. Randy Shoup.
And every time I see you grin, I'm such a happy individual.
Well, thanks for joining me on the Dr. Randy Shoup Show. I appreciate you walking down the hall with me, turning the corner, and taking a seat in Dental School 101. And I also want you to absolutely remember you have to go to the website and look at our cool new videos. We've just added a whole bunch of them to ddsradio.com. I want you to click on the Insider Videos tab, and you can experience the entire radio show in video form. You can see topics that we've talked about, everything that you need to know. It's in terms of becoming healthier, a better dental consumer. You feel better, you'll save money. And just like what we're going to talk about right now, you don't have to let the dentist take advantage of you. Go look at the great videos on ddsradio.com. And what we're talking about is, this was all part of the discussion in St. Louis, in that we are finding that across the United States, with insurance the way it is, and particularly with the whole advent of corporate dentistry. These are the dental franchises that advertise heavily on televisions and so forth. Folks get in and they show up at these places, and, you know, when dentists are trained in dental school, we're sitting in class in Dental School 101, we are trained to diagnose and be very particular and very specific. When we graduate and we walk across the stage and they give us our diploma and we walk into private practice, into our own environment, and we have real live paying patients sitting in the chair, the entire world changes, because you now have to talk to and educate and negotiate with the patient. And what we find is very common. Dentists will start to significantly erode their standards. And so a patient comes in and sits in the chair, and you look at this patient and you know this patient has periodontal or gum disease. And this patient has been coming to this office or your office for months, years, numerous years, and they've always had a, quote, cleaning, okay, a dental cleaning. You've come in, I want a cleaning. And you know that as the dentist that it is not appropriate to do just a cleaning. I tell people it's like this. If your car has rust on the fenders, if it has a dinged in bumper, if it has one of the rear view mirrors hanging off of it, and you run it through the car wash, you're not really doing much of a service to the car. Yes, you're making it cleaner, but you're not fixing anything. That is exactly the same analogy that I tell people is when you have an infection in your gums, you have tartar buildup under the gum line, you have bacteria flooding into your bloodstream because you have periodontal disease, and you demand, I just want a cleaning. It's like taking the beat up car, running it through the car wash, and expecting it all to be wonderful at the other end. It won't be, okay? So here is what I want you to understand is that the dentists will commonly fold under the pressure of the patient saying, I just want a cleaning. And dentists are reluctant to tell people bad news. They don't want to hurt people's feelings, and there is a fear factor in that if I tell you, the patient, that you have gum disease and that you need more than a cleaning, you're going to walk out the door, you're going to go down the street, you're going to go to somebody else's office who is going to be more than happy just to clean your teeth or run you through the car wash and pat you on the back and tell you you're fine, and not come back and do the periodontal therapies. And the dentists don't like to lose patients. I mean, it's honest. I'm being as honest as I can. It's a business. If you don't sit in the chair and if we don't have billable services for you, we don't make any money. We don't eat. We don't pay our mortgage. We can't pay the people that are working for our offices. So there's an economic incentive. And you worry about the patient never coming back. So I'm going to tell you, the consumer, you, the dental consumer, 3 criteria that you need to make sure you clear so that you are indeed truly a prophy, a regular cleaning patient. If you don't pass any of these three tests, you are not a regular cleaning patient. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup, and we're talking about how you, the dental consumer, because of fear, because of erosion of standards, because of a whole lot of reasons, sometimes don't get the care you need, and I'm going to tell you why this can be life-threatening for you. So here are the three reasons. Number one, the dentist or the hygienist absolutely should take that little measurer thing and go around your gums, and you're going to hear them call off a bunch of numbers. 2, 3, 2, 1, 2, 4, 5, 6, 10. All of your numbers. If you are a regular cleaning, listen to me, if you are a regular cleaning, all of your numbers have to be 3s or 2s or 1s. If you have 4s mixed in there, if you have 5s or 6s, you are a periodontal patient. End of story, end of argument, no need to discuss anything else. You are a periodontal patient, and if you are getting a cleaning, if a hygienist or a dentist measures your gums and you have 4s and 5s and you get a regular cleaning, you are absolutely being ripped off, cheated. Go someplace that will give you a periodontal therapy. The second thing is you're supposed to have current x-rays of your teeth, and you want the dentist and the hygienist to look at your x-rays, and if you have what's called radiographic, meaning it's on the x-ray, bone loss around your teeth. If they can show you, here's where the bone around your teeth should be, and here's where the bone around your teeth is, if there's a difference in those two things, you have periodontal disease. You have gum disease. You do not deserve, you do not need to be subjected to a worthless cleaning that doesn't fix your disease. So if you have numbers that are 4s, if you have bone loss that you can see and measure on your x-ray, and then the third one, and this is the biggie, this is huge, dun, 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 here it comes. If when the dentist or the hygienist measures your gums and your gums bleed, you, my friend, have periodontal disease. If you brush and floss and your gums bleed, I don't care where you're from. I don't care who you are. I don't care who you know. I don't care where you've been. You have periodontal or gum disease. You do not need to have a regular cleaning. And here's why that singular issue, bleeding, of the three is by far the most important, because it tells you everything you need to know. But the fact that bacteria are under your gums, they have been there and they've honked off your immune system. They have irritated and eroded the skin underneath your gums so badly that just touching it, it bleeds, which tells me that the blood vessels are wide open. All right? You have wide open blood vessels. And here's the kicker. Underneath your gums are what are called keystones meaning the most important, the biggest, the big daddy of them all. There are 5 keystone pathogens, and that's bacteria. There are 5 of them that live around people's gums that create this gum disease. These 5 keystone pathogens are exactly the same bacteria that when your heart surgeon goes in and does a stent in your coronary arteries or a bypass, and they take samples of your coronary artery lining, those exact same bacteria are in your heart. When people have strokes and they go back and find the location where the stroke came from, those exact same 5 keystone pathogens are in the clot that broke loose and caused your stroke. That's critical. So if you have bleeding gums, you absolutely positively know that you have the 5 major bad to the bone, nasty, disease-causing, coronary artery rotting, stroke-creating bacteria flowing into your bloodstream, circulating throughout your body, you absolutely want a periodontal therapy and not a regular cleaning, because you don't want that stuff in there. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup, and I'm trying to give you a red flag warning, empower you to go in and demand you receive the kind of care you deserve. You don't want to be cheated out of your health, because in St. Louis, one of the most clear messages from the entire 3 days was there is absolutely phenomenal information now, tremendous research indicating that you cannot be cardiovascularly healthy if you have periodontal disease. If you have periodontal disease, you magnify your risks for a heart attack or a stroke, coronary artery disease by factors of 5 and 10 and 20. So I'm here to help you be a smarter and better dental consumer, and this is the number one best way to do it. If you're a perio patient, by golly, you deserve periodontal therapies. Don't let them shuffle you off, and be a cleaning patient, because it's not going to do you any good.
You're listening to the Dr. Shoup Show. Exclusive insider info, audio, and video is online now at ddsradio.com.